Our father went to a prominent healthcare institution in the Boston area to remove stones from his left kidney by means of a commonly performed procedure. Less than 7 months later, our father died, a victim of a preventable, hospital-acquired infection. During this procedure, our father contracted a staph infection, which required him to be readmitted to the hospital repeatedly. This marked the beginning of the most horrific 6 months of his life. A staph infection is defined as outside bacteria and organisms invading the body causing disease. Hospital-acquired staph infections are spread through healthcare workers, medical instruments, and hospital surfaces. The staph infection resulted in the removal of his left kidney. When we questioned the urologist about the dangers of removing the highly infected kidney, he confidently dismissed all of our concerns. Our father hesitantly agreed to have the surgery to remove his kidney. He came home hoping that the worst was over. Both the surgeon and his primary care physician consistently dismissed our father's physical symptoms, even though he often exclaimed, "I feel terrible. I feel like I'm going to die." Several weeks later, our father was rushed to the emergency room for rectal bleeding. He bled profusely, losing more than 8 units of blood in a matter of minutes. It appeared as though he would not make it through the night. He was admitted to the medical ICU, where it was determined that the infected kidney stump had not been removed, causing the bleeding of his aorta and colon. In other words, our father was not only a victim of a hospital-acquired infection, but also a medical adverse event. The next morning, he underwent emergency surgery to repair his colon and aortic artery. Upon his discharge, he tried to resume life, but life was never the same. Although we felt optimistic that the worst was over, our father continued to feel sick and would often tell his doctors, "You guys did this to me." He felt that he was at the mercy of the doctors and a disconnected healthcare system that had failed him. During a follow-up visit with his vascular surgeon, our worst fears were realized. The emergency surgery had not been effective, and the infection continued to ravage his body. His only hope would be to undergo 2 additional bypass surgeries. During this ordeal, I silently vowed to my father that his suffering would not be in vain. It has become my mission to educate consumers to take an active role in their health care.
Our father became a victim of a fragmented healthcare system that can only change by engaging consumers and having them understand that they have a voice and it should be heard. We need to have a groundswelling interest from consumers in order to change the healthcare structure that exists today. Perhaps we need public outrage. Enough is enough. 100,000 lives are lost each year to hospital-acquired infections in the United States. This is the equivalent of a daily plane crash and all of its 273 passengers dying. I ask you, what would the FAA do, and what would the public reaction be? We need not only expect, but also demand quality health care for our loved ones and ourselves. We all need to work together to bring about change so that future generations will benefit from a reformed healthcare system.